Well, imagine not being able to walk for 4 years only to learn that surgery was available all along. That's exactly what happened to Megan Peebles. ABC News 4's Stacey Jacobson has her story.
A walk on the beach against the crash of the ocean is more than soothing for Megan Peebles. It's symbolic.
Something I wasn't able to do that now I have back, and I'm grateful for that I can be able to walk on the beach again and have a normal life.
Megan's story goes back to a cold January day at school in 2008. She was 9.
The slide had frost on it, and whenever I went to go down it, I hit the bump in the middle, which was there already, and I flew over the edge and landed in a seated position.
She says it caused pain so bad she couldn't even sit through a movie or classes at school.
Basically felt like somebody had just taken a hammer and hit my back. They would be really mean to me because I couldn't go on field trips. So one of them actually even threw a basketball at my back, saying if it hurt, you would not be able to come to school. And I wasn't able to come to school for like a week after that.
Even with doctors, it was a struggle. Megan says many didn't believe her pain.
And the 4 years were taken from me that I can never get back.
That all changed when she got an x-ray that showed something new, a rare break on a joint in her spine. She went to MUSC neurosurgeon Dr. Bruce Frankel.
The spine to move abnormally and to slip causes the discs to wear out as well.
He says her condition is rare for anyone under the age of 40. Frankel used his own invention to implant a screw in her back. Doctors around the world now use the equipment he invented at MUSC. He calls it a minimally invasive spinal system.
When we put a rod in there and tighten it down, we're able to pull the spine back into alignment without needing any other equipment.
Despite the risk of operating on someone so young, Dr. Frankel says it was a success. But it took Megan a little while to realize she had her life back.
Megan had been down for so long she was afraid to get up and walk.
Hey!
How are you?
Good, how are you?
Good to see you.
Today, Megan is back on her feet and at MUSC. She's visiting the doctor who helped her get there.
Every day I get up and I'm grateful that I can actually get out of bed without hurting. I was able to get back the life I was supposed to have.
That attitude has inspired Dr. Frankel and her nurse practitioner, Sarah Dunham. They say Megan reminds them why they're in medicine.
I think our role as providers is to teach our patients, but she's done a great job at teaching us a lot about staying strong.
I've learned that you can't give up in times of pain and things, because if you do, you won't be able to see what the future holds.
That future is wide open. Megan is on the fast track to college, on schedule to graduate high school a year early. And eventually, she wants to be a pediatric neurosurgeon, so she can follow in Frankel's footsteps and help other children like her. Stacey Jacobson, ABC News 4.
And Megan says she's still careful about what she does and uses common sense. Her next challenge, getting a driver's license. All right, we'll have more with Dave on your forecast right after this.